Hello, everyone, and welcome to this training session for UpToDate. My name is Sara Adwan, and I'm the Senior Customer Success Specialist at Walters Kluwer Health. In today's training video, I will be showing you how to access our UpToDate platform and how to navigate its different features. However, before we start with the training video, I would like to give you a small brief about what UpToDate is. UpToDate is evidence-based, physician-authored clinical decision support tool that can be accessed at the point of care. UpToDate helps you as a clinician in many ways. It increases your medical knowledge, it answers your clinical questions, and it addresses the issues related to caregiving variability in order to improve patient outcomes and streamline cost expenditure. UpToDate can be accessed in many ways. It can be accessed through your desktop browser. It can be accessed through a handheld device, such as mobile or a tablet, or it can be accessed through a link which can be embedded within your health information system at the healthcare facility where you are associated. UpToDate has been widely used across the globe. There are more than 2 million clinicians accessing UpToDate in 191 countries. UpToDate helps answers your clinical questions in form of topic reviews. Now, in order to access UpToDate platform, you can go from the Al Maktoum Medical Library, click on My Account, put your username and password. Click on Sign In. And then you go to the resources, click on databases, go to UpToDate, click on UpToDate Remote Access, and you will be taken to the UpToDate homepage. Notice that it mentions the Dubai Academic Healthcare Corporation at the top right of the screen. Now, in order to access, you can access if you have an existing username and password from the login button where you put your username and password. If you do not have an account, you may register from here. And when you register, you need to fill all the details here, such as your first name, your last name, your email, the country, the city, the specialty, and the role. And then you create your username and your password. You put the password again, and then you will click here on a send verification code. A code will be sent to the email address that you have used. You will simply put that verification code, and then your account will be activated in UpToDate. Now we will log in as if we have an account, and I will be using my username and password. As you can see, this is the UpToDate home screen or main page. Here we have a clinical toolbar with many features, such as the contents, calculators, drug interactions. Under the contents, we have many interesting features that we are going to look into through this training video. On top here, we have access to our profile, and here we see that we have some personalization, such as the history of the pages that we viewed, the most viewed pages, the bookmarked pages, and next to that, we have a count of our CMEs or CPD credits that we have earned while navigating UpToDate. Further to that, in the home screen, there's also the language icon. And from the language, you can change the language of navigation of UpToDate to any of the languages in front of us. However, the answers will always be coming in English. This is only for changing the interface navigation of UpToDate. Here, this is the main search bar in UpToDate, and here we can search using a clinical manifestation, a diagnosis, a lab test, or even a medication name. So what we're going to do now, we're going to put a condition, and I'm going to show you how to navigate the different features of UpToDate once you have done a search and you have executed your search. Once you execute your search, you will be getting results for your search. And these are or listed in the order of relevance to the keywords that you have placed here. To further narrow down your search, you can use any of these icons that we have here. If you wanted to look at only adult patient results, you click here. If you wanted to look at pediatrics, you can click here. And if you wanted to narrow down to patient educational material, you click here. And if you wanted to look at the graphics, you will click here. Now, you can see that these are the topics that are available for us to review. Under every topic, you might have noticed subtopics here, and these subtopics are the most commonly accessed subtopics within a topic. If you want to look at the full topic outline, you can click here and you can select the subtopic that you want to navigate to by clicking on it. However, if you just want to go and see the full topic outline, you simply click here and you will be taken to the full topic outline in UpToDate. All the topics in UpToDate are listed in the same way. We have the outline on the left and we have the text on the right. Looking at the summary and recommendations in UpToDate, which is one of the commonly accessed subtopics within the UpToDate topics, you will find that there is a link to a grade. We use graded recommendations to assess or evaluate the evidence from where our recommendation is coming from. If we click on this here, we will be taken to an explanation of this grade. Every graded recommendation in UpToDate consists of a number and a letter. The number can either be 1 or 2. 1, it means this is a strong recommendation and benefits clearly outweigh the risks and burdens or vice versa for most, if not all patients. If it is a weak recommendation, benefits and risks closely balanced and or are uncertain. And here we ask the doctor to look at the individual patient characteristics before taking up a weak recommendation. The letter in the recommendation signifies the strength of the evidence from where this recommendation is coming from. If it is A, it means it's high quality evidence, consistent evidence from randomized controlled trials, or overwhelming evidence of some other form. Moderate quality of evidence, evidence from randomized trials with important limitations, or very strong evidence of some other form. C, low quality of evidence, evidence from observational studies, and unsystematic clinical observations, or from randomized trials with serious flaws. If you can see here also, you have the recommendation explained to you. If you have, and for example, in this recommendation, it has the grade of 1B. A grade 1B recommendation is a strong recommendation and applies to most patients. Clinicians should follow a strong recommendation unless a clear and a compelling rationale for an alternative approach is present. Going back to our topic, I would like to highlight another thing which is quite important for UpToDate, which is our rigorous editorial process. Every topic in UpToDate undergoes a four-tier review process consisting of authors, section editors, deputy editors, and peer reviewers. Our contributors to all the topics of UpToDate are all world-renowned physicians. Many of them are affiliated with academic centers or conducting a groundbreaking research. If you want to know about any author contributing to a topic, you can simply click on their names. Their names are hyperlinked, and you will see that they have put some data here, which gives you an idea about their medical background and what they are doing. The fourth layer of peer review is the peer reviewers layer, and you can find the peer reviewers who contributed to any topic by clicking here. The same thing you will see what some information about their background listed. Going back to the topic that we have navigated, you can also notice that there are two useful dates available here. One date is the literature review current through date, and the other one is the last topic update date. The literature review current through date here basically tells you that our editorial team have scanned all the available evidence from literature, clinical journals, or society guidelines until this date, and this topic was last updated in January 13th, 2023. So, which means that we are always updating and trying to stay in current with what is happening in the field of medicine through these dates and through keeping our topics up to date. The other thing also that I would like to highlight next is that our platform is fully referenced. And in order to find out the references that are available in UpToDate against any particular topic, you can simply look at any number that is hyperlinked within the text. And if you click on this hyperlinked number, it will take you to the Medline abstract. And here there's a link to PubMed. Now, UpToDate does not provide access to medical journals. However, if the medical journal is available for you to read and it's free of cost, you can of course read it. Otherwise, you need to subscribe to that medical journal in order to be able to read it. If you want to see the full list of available references against a topic, what you can do is also go to the topic outline, click on the references, and you will see all the references available against a certain topic. Moving next, UpToDate has a huge library of graphical content as well. And the graphical content of UpToDate is also embedded within the text of UpToDate. And what you could see is, you could see, for example, hyperlinks to figures, tables, algorithms, or videos. Also, again, if you wanted to see the graphics that are available against a particular topic, all the graphics, you can simply click on the graphics from the outline here, and you will be taken to the page with all the graphical material that is available. Few things that you can do with any graphical content in UpToDate is the following. You can export it to PowerPoint if you're doing any presentation, and it will be automatically downloaded to your computer along with any available references against this material if it is there. You can also print it. You can share this content with your colleague if by simply putting their email address and typing your message, and then by clicking on the send button. Now, I want to highlight something that you can send this information to anyone, and it doesn't necessarily mean that this user has to have access to UpToDate. You can also send your feedback to our editorial team by simply filling this form. You can put your message here, click on the submit button, and our editorial team will acknowledge the receipt of your message within 24 to 48 hours. You can also bookmark this material if you frequently access it or if you frequently want to refer to this material. Moving back to the topic, also, there are a few things that you can do within any topic in UpToDate. You can look for a keyword in UpToDate in this topic. So, for example, if I'm going to search for metformin, and I'm going to execute my search, it's going to show me where metformin was mentioned and how many times by highlighting where it is mentioned in this topic. The other thing that I could do is I could reflect on any topic for CME redemption, and we will look at that later on, but you can also reflect on any topic in UpToDate by simply answering these clinical questions. And also, again, you can share this content with any user by simply putting their email address, putting your message, and then clicking on the send button. You can also increase and decrease the font of the text by using any of these options that you have, and you can bookmark this topic by clicking on the ribbon here. Also, you can send your topic feedback by clicking here, and this will go to our editorial team, and they will acknowledge the receipt of your feedback within 24 to 48 hours. Going back to the summary and recommendations, I would like to highlight another thing. You may have noticed, for example, that that the medications in UpToDate are hyperlinked. And I want to show you what you could do with any hyperlinked medication. for example, here under the summary and recommendations, you can see that the medications are hyperlinked. And if I click on it, I will be taken to the Lexicomp drug information page. Lexicomp is a sister product of Walters Kluwer Health. It falls under our clinical effectiveness umbrella. It is a sister product for UpToDate, and Lexicomp gives you information about the safe and appropriate use of medications at the point of care. The topic outline in UpToDate in Lexicomp is displayed in the same way as it is displayed in UpToDate. We have the outline on the left and we have the text on the right. The outline also gives us very useful information. We have the dosing available per the age group. So we have for adults with kidney impairment, with hepatic impairment, for geriatrics, and we do have also information regarding the administration of the medication, which is also useful for the nurses. We do have adverse reaction section. We do have warnings and precautions, and also we do have reproductive considerations and pregnancy considerations, as well as breastfeeding considerations information, which is very important to this specific group. The other feature also that we have, which is quite useful for the clinicians, is the drug interactions tool within the Lexicomp. If we click on the drug interactions, we will then click the interactions program. And here what we could do is we can simply list down the medications that our patient is taking, and then we can analyze them to see if there is any possible interactions for this medication combination. So I'm going to list down a few medications. I'm going to put an over-the-counter medication, and I'm going to put a herbal remedy or a herbal medication. And then we will click on Analyze. Notice that here we have a detailed list of the possible interactions due to this medication combination. Next to every interaction, you will find a letter. In UpToDate and Lexicomp, we use a 5-tier risk rating review process. So next to every letter, you will see, next to every interaction, you will see the letter and you will see what does this letter mean. If you want to know more about this risk rating, you can simply click here and it will tell you what do we mean by the letter next to this interaction. Now, if you want to manage the interaction and if you wanted to know in more details what you can do in terms of patient management, you can simply click on the interaction and you can see that it is hyperlinked. And it will show you a detailed analysis. And there is a patient management section in order for you to do further reading and to see how you can manage your patient with this drug interaction. If you want to look at the individual drugs listed here to see the possible interactions that they have, you can simply click here and it will give you a full list of the interactions with the ones that you need to avoid combination with at the very top. Now moving back to the UpToDate home screen, and we are going to take a look at our clinical toolbar here to see the different features that we have. We're going to start with the contents. Under the contents, there's something called What is New. Now, because we understand that it is very hard for the doctors to scan all the available literature in order to stay up to date with the current issues or the current advances that are happening in the medical field, we have brought up this feature, which brings to you what is new under the different specialities of UpToDate. This brings for you a summarized form of some useful insights that our editorial team thought it would be useful and beneficial for you as a clinician to know more about. The way to navigate what is new is simply you go to the specialty of an interest, and you see that under that specialty, there are the subspecialties. Under those subspecialties, there are some topics where there is some what is new information available. The information under the what is new is in summarized form. And if you want to know more and read more, there is a link to the full topic outline below every summary available. Going back to the contents, we are going to look at the next feature, which is the practice changing updates. The practice changing updates takes what is new a step further. And here we provide you with some more information regarding how to approach a patient condition. It could be diagnosing a patient differently, it could be adding a dose, omitting a dose, or maybe reducing a medication dose. The way the practice changing updates work is different from the what is new. The practice changing updates are time sensitive. They do not take into account any speciality. They are taking into account when was this practice change update introduced and on which date. So here, as you can see, we have the different topics, and under that you will see the practice changing update that is under that topic. And if I click on it, again, it brings for me the practice changing updates in a summarized form. And under every summary, if I wanted to read more and find more information, there is a link to a full topic outline for me to read and understand more. The next feature is the drug information. And the drug information, again, this is the tool powered by Lexicomp, which is our sister product under our clinical effectiveness umbrella. And the way we navigate the drug information is the following. We have these features available. So if I want to look at the general drug information, for example, I can click here and it will list all the medications in alphabetical order. If I can click on any of the medications here, I will be taken to the Lexicomp drug information page. Patient education is another useful tool for the clinicians. The patient educational material in UpToDate is quite vast. We have more than 1,500 educational material available, and it is divided into two buckets: basics and beyond the basics. The basics are short overviews. They are written in accordance with plain language principles and answer the 4 or 5 most important questions a person might have about a medical problem. Beyond the basics are longer, more detailed. They are best for readers who want detailed information and are comfortable with some medical terminologies. The way we navigate patient educational material is the following. We go to Contents, Patient Education, and then we select the topic of interest. If I click on diabetes, for example, I will see that I have the basics and I have beyond the basics. Under the basics, what you may have noticed is the option to change the language, and we have it available in Arabic as well as English. So if I click here, I can see that the educational material is available for me in Arabic. Few things I can do with any educational material in UpToDate. I can print it in order to share it with my patient. I can also share it with my patient by putting their email address, putting a personalized message, and then clicking on the send button. I can also increase and decrease the font, and I can bookmark this content if I refer to it quite frequently. And what I want you to also notice is that here, these are the questions that are the most commonly asked questions. And here you can see that navigating from top to the bottom of the patient education under the basics bucket is quite short and small. If we take beyond the basics, for example, you will see that it is much more detailed. The topic outline itself shows more details. There are more information provided, and navigating through the material also is more detailed as it is much larger. In order to find the information for the patient or the patient education material under a certain topic, what you can do is we can go back to the topic that we have navigated. And from the topic outline, you will notice that there is a link to information for patients. And if you click here, and we scroll down a little bit, you will see that there is the basics and beyond the basics. So it's also available from within the topic. Next is the topics by speciality. Now, as you know, we have 25 specialties of UpToDate. In order to navigate to the topic through a specialty, you do so by using the topics by specialty option. You can simply click on the specialty of an interest. These are the subtopics that are available, and these are the topics under that selected subtopic. Going back to the contents, we're going to take a look at the authors and editors next. The authors and editors are listed also by the area that they contribute to. So if you wanted to know who are the authors or editors against a particular topic, you can click on the topic of an interest and you will see a full list of the authors along with some background information about them. Calculators in UpToDate are quite vast. We have more than 200 medical calculators available. The way to look at the medical calculators in UpToDate is from the clinical toolbar. They are either listed by specialty or they are listed in alphabetical order. The other way also to look at a calculator, if it is available in any topic, is by simply executing a search, going to a topic, and you can see under the topic outline, if there is any calculator available, you can simply click on this calculator and you can see that we do have this information available against this medical calculator. Drug interactions is again what we have seen, which is powered by Lexicomp. We simply put down the names of the drugs that the patient is taking, as explained earlier. And then we click on Analyze, and you will see that there is the drug interaction list available for you based on the risk rating that is next to every interaction. Now, the other thing that I wanted to discuss with you is the importance of having a personalized account. And if you have a personalized account and you are a registered user, you do have the option of seeing the history of the pages that you have viewed, your most viewed pages also, as well as the pages that you have bookmarked. So these personalization features comes when you have your own registered UpToDate account, that's why we encourage everyone to have their own account in UpToDate. Next, I'm going to talk about the CME or the CPD points that you can earn while you are navigating in UpToDate. UpToDate CME or CPD points are accredited by Dubai Health Authority. And as you can see here, I do have the count of the credits that I have already earned by navigating the UpToDate topics. Now, a few things I can do with a credit that I have earned. If I wanted to redeem it, I will simply click here. And I will redeem the CPD credit. The way we redeem the CPD credits is by selecting the credits that we want to redeem. We either select them by credit count or by month range. I will just take a small example here. And then I will select the credit that I want to redeem. I will simply click on continue. I will reflect on this credit and notice that it becomes green once we reflect. And then once you click on continue, you will be taken to an evaluation page. And you can fill this evaluation page as well. And then you click on submit and your credit will be successfully redeemed. After redeeming the credit, you will be able to notice that your count of credits has fallen by half a credit. And then, few things that you could do with any redeemed credit is that you can see that you can view the log of the activity to see which topic that you have viewed in order to redeem this credit. You can also view the certificate that shows that you have completed this activity and you have earned this credit. Also, you can download this credit and have it saved on your desktop device. In order to see where the UpToDate credits are approved, you can also go to the accreditation statements, and you will notice that if we scroll all the way down, you will notice all the way down, if we scroll to the United Arab Emirates, you will notice that the CME credits from UpToDate are approved by the Department of Health in Abu Dhabi, Dubai Health Authority, and Dubai Healthcare City Authority Regulatory. The credits that you have earned are available for you to redeem for 2 years. In order to make sure that you have the correct settings for your CME credits, you can simply go to the settings. Make sure that you choose the Dubai Health Authority under your CME credit type, and then you save. Now that we have come to the end of this training video, I hope that this was useful, and I hope that now you are able to use UpToDate and navigate its different features. Thank you.